Hello everybody, welcome. What a way to spend a rainy Saturday. Could not be better, could it? So my name is Beverley Harden and I'm a physiotherapist. I've been qualified for 30 years this year, and I have to say that the job is as much a privilege and an amazing, amazing job as it was when I bounced out of university 30 years ago as a little physiotherapist. And every day I am wowed by the opportunities that working in the NHS, working in healthcare offer us as people, and our ability to participate in making people's lives better. And today I've got to introduce you to 14 professions. We've got 15 minutes, so I'll let you do the maths on that one. And I'm going to share my screen with you in a moment so that you can really start to get underneath the skin of these incredible professions. But as a physiotherapist, what I did when I was working in clinical practice was I worked in the intensive care unit. And you've seen through the pictures on TV over the last few months the impact of people working in intensive care units, how sick people can be. And you saw those amazing pictures of people being wheeled down the corridors and the whole staff stood by the side clapping, being so excited to see people's recovery after their long time in an intensive care unit. And that's because these jobs are absolutely incredible in our ability to make a difference to people's lives. And the beauty of what we can do in the allied health professions, as be it from a scientific perspective, a therapeutic perspective, or a psychological perspective, we work side by side people and their families and their loved ones to enable them to be the best they can possibly be at any point in their recovery, dealing with a long-term illness, or just enabling them to live with long-term disability. So I'm going to spend 14 minutes now taking you on a high-octane tour through 14 incredible professions. So buckle your seatbelts and we are off. So what is an allied health professional? This is a group of 14 professions who are here to enable people to optimize their physical, psychological and social interactions and be the best they can be physically and emotionally. You'll see there's an array of 14 different professions. We're going to take you through one by one so you can really start to understand the magical suite of different opportunity that you have within this 14 different professions. So coming through from the beginning, we've got occupational therapists. These are professionals who work across health and social care. They work in schools, they work in primary care. You find occupational therapists everywhere, enabling people from a psychological and a physical perspective to maximize their occupation. And what I mean by occupation is their ability to interact with work, with social engagement, and the ability to absolutely maximize their physical and psychological intervention with the world. It's an incredible profession to help people absolutely keep themselves engaged in society and contributing to society, be it in any different walk of life or any different age group. Podiatrists, again, an incredible group. They deal with the lower limb. My father's life was saved on numerous occasions by a fantastic multi-professional team where podiatry were leading the care of his very, very vulnerable diabetic feet. He had a terrible problem with diabetic foot ulcers that would not heal. But the magic of the podiatrist is that their exquisite knowledge of the biomechanical structure of the foot and the ability of the structure of the foot, which is the most complex thing you could ever imagine, to be able to weight bear and not put weight in the wrong places, that leads then to the destruction of tissue and the real challenge of somebody with diabetes who can't heal properly, their ability to manage their lower limbs and prevent amputation. You cannot imagine the impact on a person's life of losing a limb, their ability to stay at home, their ability to stay at work, the role of a podiatrist in preventing amputation, but also the incredible work in sports around the ability to optimize the biomechanical function of the feet, an incredible profession enabling you to really bring together the skills of tissue viability and biomechanics. Quite incredible. We then have paramedics, and you've all seen paramedics. You see the ambulance fly by, you see the air ambulance fly over the sky. But did you know that paramedics are also present in hospitals and emergency departments, in primary care, absolutely at the forefront of life-saving care and response? Quite an incredible group of staff. And you're going to see how many times I use the word incredible over the next 15 minutes, because these really are amazing professions that generally you don't really see and don't really think about how you might become. So a paramedic is an incredibly flexible and adaptable member of the team. And the magic of being on the blue light and the privilege of going into people's homes in perhaps their most challenging moments, and the incredible skill set and the emotional skills of the paramedic to be with that family in their crisis moment and to support them and to enable them to access the care that they need, or to stay at home and have the care that they require at home. And you'll see paramedics across TV programs, left, right and centre. So watch it, enjoy it, and go be one of them. The operating department practitioner, you'll see them there gowned up with their mask on. This professional group, we refer to it as the secret weapon of the NHS. Very, very unseen so often, but absolutely the crucial member of an operating department, working alongside the anaesthetist and the nursing team, optimising safety, being with that patient and their family before, during and after the operation. And again, the role of the operating department practitioner is accelerating beyond our imaginings, as we now find ODPs out in intensive care, in the emergency department, responding in advanced practice roles, offering their expertise in managing people who are acutely unwell or quite unstable, and helping support the teams and use their skills in different environments. And you'll see the live operating theatre this afternoon, and then you'll see in Aspiring 1 later on the ability to talk to David, who's a third-year ODP student and absolutely a fantastic advocate for the profession. So then I've now managed to share my screen in a different way. We then move into our psychological group of allied health professions, the arts, music and drama therapists. And if you are a psychologically minded person, you want to deal with people who are requiring the services of mental health services, or wanting to work in the community with people in social prescribing or voluntary sector organisations, helping people to be the best they can be and to manage their psychological conditions, and to work with people who may be depressed, lonely, anxious. You've got three amazing professions here that enable you to bring together the skills in your world, which might be your love of art, music or drama, alongside perhaps your love of psychology, and to bring these professions together. And these are all three are postgraduate professions. You go and do your first degree, and then you come back in and you do your then do your psychological therapy training, but through the lens of your artistic skill set. And again, really worth looking at the Health Careers website to get the absolute detail on which degrees are optimal to move into these professions. But quite an exquisite group of psychological professions, but done through the media of artistic mechanisms. Quite incredible. Diagnostic and therapeutic radiography. They both share the word radiography. There are some similarities, but really quite different professions. You've come across diagnostic radiographers when you've been into casualty with your broken bone. Incredible group of staff. Again, often underestimated, because you see them positioning you really carefully and compassionately with your broken limb to have your x-ray taken. But actually then what happens behind the scenes is the incredible technical understanding and physics knowledge of this group of staff, their ability to look at the x-rays, interpret the x-rays and diagnose on the basis of those x-rays with further training is an incredible opportunity there to be front and centre in diagnostic services. And these two professions are huge growth professions for the future. A lot of extra spaces in clearing this year with government expansion post-COVID, because radiographers were absolutely front and centre in the response to COVID. So an incredible profession, and Michelle will talk later in Aspiring 1 about diagnostic radiography. Therapeutic radiography uses the science and the genius of radiation, but in the treatment of cancer. And again, an incredible job for people who love physics and love that world of thinking that they like to work with radiation, etc., but actually through the lens of being an utterly compassionate human. Can you imagine going on a journey, seeing people several times per week in a therapeutic radiography setting where you are administering the radiotherapy, the life-saving treatment for their cancer diagnosis? Can you imagine the emotional connection with people and the importance of being together in that moment so that you're actually able to help and support that family on their journey through living with and dealing with cancer? Quite the most incredible privilege. Requires special people, but that could be you. And if it is, you may well not have thought about this as a profession. Physiotherapist, that's me. Again, it's all about exercise. It's about physical rehabilitation, using a psychological perspective to how we work with and manage the recovery and the rehabilitation of people. Quite the most incredible profession of being able to work alongside people to bring them back to their full optimum functioning, whatever that may be. It may not be what it was before their accident or their illness or their injury, but it's absolutely enabling to be the best they can possibly be in getting out there and getting on with their lives. And that's the key to what we do. It's optimizing people's ability to live with or to recover from illness. And orthotists are aimed at really the physiotherapists of the eyeball was how they were described to once. They really deal with the muscular and the nervous system interactions with the eyes to enable the two eyes to work together and to enable the eyes to really start to work side by side together to optimize vision and sight and you work with the most incredible range of people, from children right the way through to the elderly, with people with dementia, but an incredible ability to optimize people's sight. You cannot begin to imagine, if you could not see properly, the different effect it would have on your existence, and the privilege you have today of engaging with us in this way virtually. Without vision, you are not in the position to engage anywhere like you are if you are able to optimize sight. So what a gift to be able to work alongside people to optimize sight. And in the same context, you've got the speech and language therapists. Can you imagine if you couldn't talk? Can you imagine? I'd burst if I couldn't talk. And if you're not able to swallow, not even able to eat, but not even able to manage your own saliva. Can you imagine if you could not even manage the saliva in your mouth at the moment? That would be a terrifying, terrifying place to be. And the speech and language therapists work with people every single day, from working with people who stutter and the life transforming impact of then being able to manage your stutter, through to people post-stroke who perhaps can't swallow, or people with muscular conditions who can't swallow. So what an amazing impact on people's lives. Each profession making a fundamental difference to people's lives. The osteopath in musculoskeletal conditions, a lot working in private practice, but increasing now working in the NHS, in primary care and in hospital services. A wonderful profession enabling you to work with people in the moment, optimising their musculoskeletal health, preventing injury and preventing people from necessarily having surgery if they don't require surgery at that time. And the dietitians, you'll hear from Rachel and the team later on, incredible ability to work with food. Nature's oldest medicine, the ability to optimise diet, either for the management of weight, either to put on weight or to lose weight, but also in the management of disease and the ability to use nutrition to help people be the best they can be. And the last two professions, prosthetics and orthotics, our smallest profession, but I believe perhaps our most beautiful. And had I had my time again and I'd been a bit better at engineering, I would have been a prosthetist. Prosthetists deal with the people with an amputation or with limb loss, or being born without limbs, and they help people by supporting them with the creation of and the supply of prosthetics and the enabling of them to use those prosthetics, false arms, false legs. If you look on LinkedIn, there's a most incredible set of profiles around the different use of prosthetics. And there's a picture of somebody who's a paintballer, an international paintballing champion who lost his arm in an accident. And they equipped him with an artificial arm that enabled him to compete still at international level and paintball. I mean, a strange example, but incredible in what matters to him as a human and living his life. And the tweet I add to the screen here just makes my heart sing. This is everything that I'm on the planet to do, which is to work with people in the moment. And you see here a 4-year-old girl with her prosthetic limb, born without a limb. She gets her prosthetic limb. Can you imagine being a 4-year-old girl at school with a prosthetic limb? Give me that limb and I can begin to cope with that, and I can begin to define myself as me in that space. Give her a doll on her 4th birthday with the same limb, and that just makes me so proud of what we are here to do with people. And orthotists work in a very similar vein, working with people to optimise function, but by the use of braces and orthotics. And you'll have seen colleagues in school either with cerebral palsy or with other conditions that impact particularly on their walking, and the ability to give people function and enable people to walk who could not otherwise walk without their orthoses is, again, quite an incredible ability to impact on people's lives. The WOW show, I'm not going to take time to show this to you just yet, but you'll see it in the hub. We've got the booth and you'll see the whole WOW show to play through, but I want to spend time on things that you can't in different ways. You'll also find on, you've got the web link here at the bottom, some fantastic virtual work experiences across podiatry, orthoptists, prosthetists, and orthotists, therapeutic radiography and dietetics at the moment, created by some incredible colleagues of mine, giving you the ability to take a bird's eye view into the profession, particularly at the moment when it's quite hard to get hold of work experience. So again, quite a helpful group of resources there. So please do come back to these slides afterwards and go hunt out those web resources. Coming into these professions, you can come in through you can be a support worker and work your way into these professions. Our support workforce is some of our most important people in the team. So there's room for everybody in the AHP family. There's apprenticeship routes in, you can do a standard degree, you can do a postgraduate master's degree, you can return to practice having left after a long time and come back in, we support you with that. Or we have a lot of colleagues who come in from the armed forces or from other career changes, and post-COVID, we have a lot of people who come into the services having left their previous employment to retrain with us. Again, incredible resources, you'll find them in our hub. And you can work across anything. In my career, I've worked in Canada, I've volunteered in Romania, I've worked in leadership and management roles regionally, locally, nationally. I've had the privilege working in research, I now work in education. And you look at all the different opportunities on that slide, and again, you'll find in the hub a fantastic animation that just shows you the incredible 360-degree magic of what we have in our professions. And you will see that we have got you'll have seen through all the media the incredible students that we have in our AHP professions. They have been working at the front line during COVID. Beautiful documentary in the BBC, lovely case studies on our website of students who've been in clinical practice during COVID. Their fantastic contribution and really wanting to be part of making a difference now at this moment. And the government has come forward and said that this year there will be more spaces in clearing this year. We've got significant increase in numbers of places available. So if you're looking at clearing this year, be ambitious, come join our family. And actually, if you're looking to future years, there will be more spaces in the future. So please come and join us. And I just leave you with our family illustrated on the screen there. And to say, think differently, think broadly. The NHS has got 350-ish different professions in it. You've got so much choice. It's not bewildering, it's brilliant when you start thinking about what makes you bounce out of bed, like I bounce out of bed every morning. What helps you make the difference that you want to make to people's lives, and go find your space in what is, as we heard earlier on one of the presentations, the third biggest employer in the world. Come join us. Thank you very much indeed.